I'm Nicola Golby, Associate Superintendent of Student Services. Last fall, Alberta Education provided a grant opportunity that we could partner up with some of our other systems and come up with a plan to serve mental health in the schools. So we put an application to develop a district behavior support team. Our thinking was that we would partner with the local PCN and we would develop a team, and they're at Central Services, but they're really out working across the city, developing mental health strategies for students, supporting teachers all around the city. The grants were available across the province, and all of the information from those grants goes back to the U of C. And the researchers at the U of C are looking at the best practices for supporting student mental health around the province and trying to develop some guidelines and best practices over the course of the 2 years that this pilot will run. There were times when we were hearing from schools that there were some pretty extreme behavior events happening just in little silos here and there. And that's not typically what happens in school. So that could be kind of distressing for the students and also distressing for the staff. So our schools are trauma informed. They do a great job, but sometimes it's nice to have a person come in from the outside and just be a bit of a support, help debrief, help make sure that the dignity of the student is taken care of, and then also to provide some strategies for the teachers moving forward. I'd like to introduce the members of the Behaviour Support Team.
Hi, I'm Tori Deans. I'm a registered psychiatric nurse. I've been nursing for just over 12 years with adults as well as children in the community and in the hospital setting.
My name is Glenda Crawford. I am a teacher with Red Republic and have been working with Red Republic for over 40 years now. I have spent most of my career working with students with complex needs.
Hello, my name is Janice Kootenay. I'm the clinical supervisor and social worker on the Behaviour Support Team. Excited to be here with Red Republic, offering services to kids and families and our school community from a neurosequential lens. So when we think about behavior in our schools, what comes to mind for us around philosophy would be kids need to have a sense of belongingness and feel safe. And so in order to do that, we created what we call our student support rooms, with an understanding of a neurosequential lens. So part of our training included Dr. Bruce Perry's neurosequential model, which all of our student support team teachers have been learning about. However, the behavior support team comes out and also is providing opportunities to teach and learn and grow with one another, with students, with staff, to build capacity in our schools. We want to create a sense of belongingness, mastery, independence, and generosity, which comes from Dr. Martin Brokenleg's Circle of Courage. We also are looking at building in opportunities to understand resilience and what that might look like in our schools as well.
What we're hearing from the schools is that it's helpful that a fresh set of eyes from different lenses come in to support them. We know our schools are working really hard. However, there are some complex needs with students and with families. So we're able to come in, offer reassurance that what they're already doing is working, problem solve with them, give them new strategies, and help build the capacity of the teams already working so hard at the school. So we're getting really good feedback, helping families, helping students, and supporting regulation has been really positive.
I'm really excited to say that we are having what I think is a strong impact on Red Republic schools. We've been into schools 315 plus interactions. We have supported over hundreds of staff in in-servicing and information. And the impact on students, we're starting to see some attendance improvements. We know we're getting some academic improvements, all the things that we want students to do so that they're feeling safe and they're feeling important and they're feeling connected in their schools. It's been important to watch how students are able to use their strategies and use their tools and be successful in school in ways that they haven't ever been able to before.
Now that we finished our first year working as a behavior support team and we're moving into our second year, as Glenda mentioned, there are hundreds of visits out in the schools, lots of time spent with families, lots of time spent with students and teachers. Just so proud of how this team's been working together and really trying to support. We're always open to hearing what the schools need and just trying to be responsive to that. So the mental health needs of our students, especially after the pandemic, are looked after.